Welcome to Revive Training, Virginia's Opioid Overdose and Naloxone Education Program by the Virginia Department of Behavioral Health and Developmental Services. Learning objectives. Understand the Revive program and legislation. Understand addiction. Understand how opioid overdose emergencies happen and how to recognize them. Understand how naloxone works. Identify risk factors that may make someone more susceptible to an opioid overdose emergency. Dispel common myths about how to reverse an opioid overdose, and learn how to respond to an opioid overdose emergency with the administration of naloxone. The case for naloxone education. Since 2013, fatal drug overdose has been the leading method of unnatural death in Virginia, surpassing all other forms of unnatural death, including homicide, suicide, motor vehicle accidents, and undetermined deaths. In 2019, there were 1,289 deaths from all opioids, which includes all versions of fentanyl, heroin, prescription opioids, and illicitly manufactured synthetic opioids. Legal protections in overdose response. Virginia has a Good Samaritan law. That means that any person who in good faith administers naloxone or other opioid antagonist used for overdose reversal to a person who is believed to be experiencing or about to experiencing a life-threatening opioid overdose shall not be liable for any civil damages or for any personal injury. A person who is not otherwise authorized to administer naloxone or other opioid antagonist used for overdose reversal may administer naloxone or other opioid antagonist used for overdose reversal to a person who is believed to be experiencing or about to experience a life-threatening opioid overdose. Safe reporting of overdoses. This applies to people involved in an overdose situation. Arrest and prosecution when experiencing or reporting overdoses. So no individual shall be arrested or prosecuted for purchasing, possessing, or consuming alcohol, controlled substances, or marijuana if they're reporting a possible overdose. That individual must remain at the scene, identify themselves, and cooperate with law enforcement. But there is a defense called affirmative defense, which will protect those involved in the overdose from being prosecuted as long as they are trying to get help. In the state of Virginia, there is a standing order for naloxone access. A standing order has been issued for the state of Virginia, allowing for individuals to go to any pharmacy to purchase naloxone without first obtaining a prescription from your doctor. Naloxone can be obtained from local health departments, community service boards, or community pharmacies without a prescription. If you go to a community pharmacy, you may use your insurance and just pay your copay. Or you can go to any pharmacy and request naloxone and pay out of pocket. The price is approximately $130 to $140. Understanding addiction. People don't plan to get addicted to drugs. When people first take a drug, they might like how it makes them feel. They believe they can control how much and how often they take the drug. But drugs can take away people's control. Drugs can change the brain. Addiction refers to substance use disorders at the severe end of the spectrum and is characterized by a person's inability to control the impulse to use drugs even when there are negative consequences. Addiction is the difference between wanting to use and needing to use. With addiction, you need to use. What is an opioid? Opioids are a class of drugs that include heroin, synthetic opioids like fentanyl, and pain relievers available legally by prescription, such as oxycodone, hydrocodone, or morphine. Please take a moment to review common opioids. This chart gives the generic name, the trade name, and the street name. What is an opioid overdose? The brain has many receptors. These are protein in the brain that a molecule can bind to. An opioid fits exactly in the receptor. The brain has many receptors for opioids. Too much opioid fitting in too many receptors slows and stops the breathing. Take a moment to think about what are the risk factors that can make someone more likely to experience an overdose. Risk factors for opioid overdose. Certain people are at a higher risk for opioid overdose emergencies, including someone that has a prior overdose. This is the strongest predictor of another overdose. Reduced tolerance. Previous users who have stopped using due to abstinence, illness, treatment, or incarceration. They may use the same amount they used to use, but they no longer have tolerance for that dose. Mixing drugs. Combining opioids with other drugs, including alcohol, stimulants, or depressants. Combining stimulants and depressants do not cancel each other out. Often people mix drugs trying to enhance the effect. Using alone is a strong risk factor. Variations in strength or quantity or changing formulas, switching from quick-acting to long-acting to extended release, again trying to enhance the effect. And medical conditions such as chronic lung disease or kidney or liver problems. People with these issues do not metabolize or excrete medication in the same way. How can you tell the difference between someone who is high and someone who has overdosed? Signs of an opioid overdose. Someone who is really high has muscles that are relaxed. Someone who is overdosed, face is very pale or clammy. Someone who is really high has speech that is slowed or slurred. Someone who is overdosed, breathing is infrequent or breathing has stopped. Someone who is really high is sleepy looking or nodding out. Someone who is overdosed has deep snoring or gurgling, often called a death rattle. Someone who is really high is responsive to shouting, sternal rub, or earlobe pinching. Someone who is overdosed is unresponsive to any stimuli. Someone who is really high has a normal heart rate and or pulse and a normal skin tone. Someone who is overdosed has a slow or no heart rate and or pulse. Someone who is really high has pupils that will contract and appear small, pinpoint pupils. For someone who is overdosed, the skin tone turns bluish or grayish or ashen. If someone is making unfamiliar sounds while sleeping, it is worth trying to wake him up. Many loved ones of users think a person is snoring when in fact that person was overdosing. These situations are a missed opportunity to intervene and save a life. Take a moment to think, what are some myths you have heard about ways to reverse an opioid overdose? Myths on overdose response. There are many myths about how to reverse an opioid overdose. Here are some and why you should not do them. Do not put the individual in a bath. They could drown. Do not induce vomiting or give the individual something to drink. They could choke. Do not put the person in an ice bath or put ice in their clothing or in any bodily orifices. Cooling down the core temperature of an individual who is experiencing an opioid overdose emergency is dangerous because it can further depress their heart rate. Do not try and stimulate the individual in a way that could cause harm, such as slapping them hard, kicking them, or other more aggressive actions that may cause long-term physical damage. Do not inject them with any foreign substance, salt water or milk, for instance, or other drugs to force them to eat or drink anything. It will not help reverse the overdose and may expose the individual to bacterial or viral infections, abscesses, endocarditis, cellulitis, and choking. Naloxone is the only effective response to an opioid overdose emergency. What is naloxone? Naloxone is a medication designed to rapidly reverse opioid overdose. It is available in 3 FDA-approved formulations: injectable, auto-injectable, and prepackaged nasal spray. How naloxone works. Naloxone has a stronger affinity or attraction to the opioid receptors than the opioid, so it knocks the opioid off the receptors for a short time, 30 to 90 minutes, and lets the person breathe again. Naloxone works by binding to the opioid receptors in the brain in place of the drug. It reverses respiratory issues, but not necessarily cardiac issues. There is no potential for abuse and no effect if given by accident. Narcan nasal spray. There are 2 doses in each kit. In opioid overdose emergencies, recognizing symptoms and taking prompt action is critical to potentially saving a life. If you suspect an opioid overdose, administer Narcan nasal spray and get emergency medical assistance right away. You peel the back of the package to remove the device. Hold the device with your thumb on the bottom of the plunger and 2 fingers on the nozzle. Place and hold the tip of the nozzle in either nostril until your fingers touch the bottom of the patient's nose. Press the plunger firmly to release the dose into the patient's nose. inVA auto-injector. Pull the inVA from the outer case. Do not go to step 2. Remove the red safety guard until you are ready to use the medication. If you are not ready to use it, put it back in the outer case for later use. Pull off the red safety guard. To reduce the chance of an accidental injection, do not touch the black base of the auto-injector, which is where the needle comes out. If an accidental injection happens, get medical help right away. The red safety guard is made to fit tightly. Pull firmly to remove. Do not replace the red safety guard after it is removed. Place the black end against the middle of the outer thigh, through the clothing, pants, etc. if necessary. Then press firmly and hold in place for 5 seconds. The needle will inject and then retract back up into the inVA auto-injector and is not visible after use. Injectable naloxone. Injectable naloxone. Remove the cap from the naloxone vial and uncover the needle. Insert the needle through the rubber plug with the vial side down. Pull back on plunger and take up to 1 milliliter. Inject 1 milliliter of naloxone into an upper arm or thigh muscle. If no reaction in 3 minutes, give a second dose. Use a long needle. Virginia requires a 3 milliliter syringe and a 23 to 25 gauge and 1 to 1.5 inch IM needle. If available, clean the skin with an alcohol swab first. It's okay to inject through clothing if necessary. Make sure you are injecting at a 90-degree angle to make sure you reach the muscle. How to store naloxone. Naloxone has a shelf life of approximately 2 years. Naloxone may be stored for short periods of time up to 104 degrees. Do not store in the car on hot summer days. Do not freeze or leave in a car during the winter. Naloxone may not be as effective if it is not stored properly. Naloxone does no harm when expired, so you may use an expired dose in an emergency if new doses are not available. Store in a dark place and protect from light. Keep out of the reach of children. Safety of naloxone. Serious side effects from naloxone use are very rare. Using naloxone during an overdose far outweighs any risk of side effects. If the cause of the unconsciousness is uncertain, give naloxone is not likely to cause further harm to the person. Reported side effects are often related to acute opioid withdrawal. Naloxone will not reverse overdoses from other drugs such as alcohol, benzodiazepines, cocaine, or amphetamines. Naloxone has no abuse potential. Naloxone has the same dose for an adult and for a child. Steps to respond to an opioid overdose. 1. Check for responsiveness. 2. Call 911. If you must leave the individual alone, place them into a recovery position. 3. Give 2 rescue breaths if the person is not breathing. 4. Administer naloxone. 5. Continue rescue breathing if the person is still not breathing. And 6. Assess and respond based on the outcome of first naloxone administration. 1. Check for responsiveness. Try to stimulate them. You can shout their name, tap their shoulder, or pinch their earlobe. Give a sternal rub. Make a fist and rake your knuckles hard up and down of the person's sternum, their breastbone. This is sometimes enough to wake the person up. Check your breathing. Put your ear to the person's mouth and nose so that you can also watch their chest. Feel for breath and watch to see if the person's chest rises and falls. If the person does not respond or is not breathing, proceed to step 2. 2. Call 911. Calling 911 immediately when responding to an overdose is vital. An individual who has overdosed needs to be assessed by medical professionals. If there is more than one person around, instruct another individual to call 911. If with the cell phone, call 911, put the call on speakerphone, and place the phone on the ground. Report that the person's breathing has slowed or stopped, he or she is unresponsive, it is suspected overdose, and give the exact location. Recovery position. If you need to leave the person to get your naloxone kit or for any other reason, put them in the recovery position. Place the overdose victim flat on their back. Roll the person over slightly onto their side. Bend their top knee. Put the person's top hand under their head. This position should keep the person from rolling onto the stomach or back and prevent them from asphyxiation in case of vomiting. Make sure the person is accessible and visible to first responders. Don't close or lock doors that would keep first responders from being able to find or access the person. Give 2 rescue breaths. Place the person on their back. Tilt their chin up to open the airway. Plug their nose with one hand and give 2 even, regular-sized breaths. Blow enough air into their lungs to make their chest rise. If you don't see their chest rise out of the corner of your eye, tilt the head back more and make sure you're plugging their nose. Administer naloxone. Naloxone usually starts working within 30 to 45 seconds after it's been given, but we give the person up to 3 minutes to respond. While you wait for naloxone to take effect, immediately begin step 5. Rescue breathing or CPR. If a rescuer is CPR trained or instructed to do so by 911, place the person on their back, tilt their chin up to open their airway, plug their nose with one hand and give 2 even, regular-sized breaths. Blow enough air into their lungs to make their chest rise. If you don't see their chest rise out of the corner of your eye, tilt the head back more and make sure you're plugging the nose. Give 1 breath every 5 seconds. Please note, you may have heard that recent CPR guidelines recommend hands-only CPR or only chest compressions instead of rescue breathing and chest compressions. These guidelines are for cardiac arrest and not for overdose. It is still recommended that you perform rescue breathing for an overdose where the primary issue is respiratory depression and not cardiac arrest. Brain damage can occur after 3 to 5 minutes without oxygen. Rescue breathing gets oxygen to the brain quickly. Once you give naloxone, it may take some time for it to take effect, so the person may not start breathing on their own right away. Continue rescue breathing or CPR for them until the naloxone takes effect or until emergency medical services arise. Assess and respond. Most individuals will recover after a single dose of naloxone is administered. Ideally, while performing step 5, the person will begin breathing on their own. However, there are 2 cases in which you may need to administer a second dose of naloxone. Situation A, if the individual has not responded to the initial dose within 3 minutes. Situation B, if the individual has relapsed into an overdose again after having previously recovered with the initial dose. When to give a second dose of naloxone. Situation A, the individual has not responded to the initial dose within 3 minutes. When this occurs, naloxone should take effect within 30, 40 to 5 seconds, but may take longer. Wait 3 minutes, continue rescuing breathing and CPR during this time. At 3 minutes, if still no response, administer a second dose of naloxone. If the person remains unresponsive after the second dose is administered, continue rescue breathing CPR until emergency medical services has arrived. When to give a second dose of naloxone. Situation B. The individual has relapsed into an overdose again and after having previously recovered with the initial dose. Naloxone has a very short half-life, 30 to 90 minutes. In some cases, there is so much opioid in the system that the person can relapse back into overdose after the naloxone has worn off. If this occurs, repeat steps 1 through 5. Continue rescue breathing, CPR, until person recovers or until emergency medical arrives. Aftercare of a recovered person. People wake up from an overdose differently. While people are often confused and anxious, they are rarely violent or combative. This is a person in psychological distress. Many times when people overdose, they don't realize what has happened. Explain what has happened and emphasize the importance of waiting for emergency medical services to arrive so they can be assessed. If the person is dependent on opioids, they will be in withdrawal since opioids cannot attach to the receptors while naloxone is present. Even if they take more drugs, it will not help. Let them know that once naloxone wears off, they could potentially relapse into an overdose again if opioids are still in their system. Take a moment to review hands-on training. Now let's see how much you know. Click on the link in the comments below to take a 5-question post-test. You must get 70% to pass. When you pass, a certificate will be emailed to you. Thank you for participating.